In the quaint and serene town of Manchester Township, New Jersey, Sherri Ann Cutrona lived out her final years. The town was a place of quiet streets lined with trees, where neighbors knew each other and life moved at a gentle pace. Sherri Ann, born sometime between 1962 and 1963, passed away on July 16, 2020, at the age of 57. Her journey began in Hackensack, New Jersey, where she was born and raised. The bustling city, with its rich history and vibrant community, was a stark contrast to the more laid-back atmosphere of Manchester Township, where she moved 3 years before her death. Before settling in Manchester, she had lived in Brick, another charming locale of New Jersey. Sherri Ann's professional life was marked by her role as an engineer for Hayco products in Toms River, where she worked before retiring. She was not just a dedicated professional, but also an active member of various support groups, including the Tracheobronchomalacia (TBM) support group and a Facebook group for empty nose syndrome victims. These groups became lifelines for her as she navigated her health challenges. Sherri Ann had a passion for dancing, cooking, sewing, and going on cruises. Dancing brought her immense joy and allowed her to express herself freely. Cooking was a way to bring her family together, sharing delicious meals and creating lasting memories. Sherri Ann was a mother to 2 sons. She was also the beloved daughter and sister. Her family was her anchor, providing support and love through her many trials. Her final wish was for her ashes to be scattered at sea, a testament to her enduring love for the ocean and its boundless horizon. Her journey with empty nose syndrome, ENS, was particularly harrowing. It was a condition that affected her deeply, leading to numerous consultations and treatments with various specialists. One notable consultation was with Dr. Orrin Friedman at Penn in Philadelphia. He confirmed her ENS diagnosis, but offered little in the way of hope, prescribing only creams and ointments that did not alleviate her suffering. Sherri Ann left the appointment feeling a profound sense of disappointment and abandonment. Another consultation, this time over the phone with Dr. Das, brought a glimmer of understanding. Dr. Das explained that her inferior turbinates had been reduced by about 50%. His compassion and knowledge stood in stark contrast to the dismissive attitudes of many other doctors. This small measure of empathy was a refreshing change for Sherri Ann, who had often felt marginalized by the medical community. Sherri Ann's frustrations were palpable as she described her declining health. The installation of a port to facilitate IVIG infusions due to her deteriorating veins was a particularly distressing development. She lamented the myriad health issues stemming from her turbinate surgery many years earlier, which had drastically diminished her quality of life. Her daily struggles and severe symptoms made her long for just a few days of wellness. In her quest for relief, Sherri Ann sought advice from others about their experiences with nasal implants, particularly those who had surgery with Dr. Nyack. She was curious about recovery times and satisfaction with results, hoping for a positive outcome. Despite reassurances from fellow sufferers, she continued to experience severe ENS symptoms. She contemplated getting a new CT scan and sending it to Ohio State University for further evaluation. Even with implants, she felt a relentless dryness, describing it as desert dry. Sherri Ann's health challenges were significant. Chronic sinus and respiratory infections plagued her for years, leading to severe asthma, GERD, reflux, and sleep apnea. Her condition worsened when her trachea and main bronchus collapsed, requiring major surgery to install mesh supports. These complications were attributed to her chronic infections, exposure to burning plastics at work, prolonged steroid use, and empty nose syndrome, ENS. Sherri Ann's struggle with recurring lung infections was closely linked to her ENS. A fully functioning nose produces nitric oxide, a gas that is inhaled with each breath and is strongly antiviral and antibacterial. Due to the amputation of her turbinates, Sherri Ann's nose remained wide open, unable to filter air or produce this crucial gas. As a result, bacteria and viruses entered her lungs unfiltered, likely causing the many lung infections she suffered from. The information we have indicates that it was another lung infection that led to her final hospital admission, where she later passed away. Reflecting on her years of suffering, Sherri Ann realized she had been living with undiagnosed ENS for a long time. The condition had worsened with age, and an endoscopic examination revealed the extent of the damage from her previous laser turbinate reduction. She felt disheartened by the lack of understanding and support she had received over the years. She often expressed her deep frustration over the lack of effective treatments and research for ENS. Tragically, she lived most of her life without knowing that her problems were related to a previous operation where her turbinates were amputated by 50%. In an attempt to find relief, Sherri Ann underwent an experimental surgery to add nasal implants to create more volume in her nose. Dr. Overdevst performed the procedure, but 4 months later, she saw no improvement. She explored stem cell injections as a potential treatment and had an appointment scheduled. She also had a CFD study performed before her implants, hoping for insights about her condition. Despite her relentless suffering, Sherri Ann found solace in her faith and the support of fellow sufferers. She continued to seek new medical opinions and treatments, holding on to the belief that relief was possible. Sherri Ann's story is a poignant reminder of the severe impact turbinate reduction can have on one's life. Her battle with empty nose syndrome, ENS, sheds light on a condition often misunderstood and overlooked. ENS occurs when nasal surgeries like turbinate reduction leave the nasal passages unnaturally open, stripping away the natural defenses and disrupting airflow dynamics crucial for respiratory health. This condition not only leads to physical discomfort, but also profound psychological strain, as individuals struggle with constant feelings of air hunger and breathlessness, often affecting their ability to relax and sleep. Over the past few decades, the number of nasal surgeries has surged with the advent of endoscopic techniques. Many ear, nose, and throat (ENT) surgeons perform turbinate reductions routinely, often without adequate follow-up or disclosure of potential complications. This has contributed to a significant rise in cases where patients experience debilitating symptoms. These symptoms often start gradually, months or even years after the surgery, and many are unaware that their respiratory issues stem from past nasal procedures. It is estimated that up to 20% of all turbinate surgeries are performed aggressively enough to result in ENS, yet patients are not informed of these risks beforehand. Additionally, ongoing destruction of nasal mucosa due to surgery-induced dryness exacerbates symptoms over time, gradually impairing respiratory function and quality of life. Sherri Ann's story underscores the urgent need for greater awareness and transparency in nasal surgeries. Her journey, marked by relentless health battles and the quest for relief, serves as a poignant reminder of the complexities and challenges faced by those who undergo surgery on their turbinates. As we honor her memory, we are reminded of the importance of advocating for informed consent. Surgeons must warn about these complications so people can make informed decisions. How many would proceed with surgery if they knew there was a 20% chance of becoming totally disabled? Sherri Ann Cutrona, who passed away on July 16, 2020, leaves behind a legacy of resilience and courage in the face of immense challenges. Her journey vividly illustrates the critical importance of informed consent in medical procedures that can profoundly impact one's life. The severe consequences of nasal surgeries, such as those experienced by Sherri Ann, serve as a stark warning. They can irreversibly alter one's health and quality of life. Sherri Ann's battle with empty nose syndrome, ENS, exemplifies the silent struggles endured by many, where life is divided into a before and after, marked by profound physical and emotional changes. As we reflect on her story, we are reminded of the urgent need for greater transparency and understanding in ear, nose, and throat medical practices. May her legacy inspire advocacy for patient rights and informed decision-making, ensuring that no one faces such life-altering consequences without full awareness and support.